Hi, I'm Dr. Chris Salerno, Chief Editor of Dental Economics. I'm at the IDS 2017 show in Cologne, and I'm here with Anna from Hu-Friedy. Now, Hu-Friedy, I'm sure people at home know that they are manufacturers, fine manufacturers of dental instruments, but what they hopefully know too is that they also were the leaders in the cassette solution. Can you tell me a little bit about the history of Hu-Friedy and the cassette solution?
Hi, thank you, Chris. I am Anna Busia. I am the Product Manager IMS and Infection Control at Hu-Friedy. And then thank you for your question, because it is really, this is, I can say, like a box, but it is not a box. This is like a solution that, Hu-Friedy is not only an instrument manufacturer, but it is like to provide what is all around the solution, all around the instrument. So we were the first as Hu-Friedy in 1984 to start with this system of cassette in order to protect the personnel in the dental office for the potential injuries during the cleaning and reprocessing of instruments. So we started first in the world in the dental with this system that you can see that we did like a checklist, like a protocol that we call a 6-step protocol for the cleaning and reprocessing of instruments, and then by the use of these cassettes, so you have all your instruments well organized by procedure.
So can you tell me about that 6-step process? So dentists that are considering getting the cassette solution for all of the great reasons you mentioned, the safety, the repeatable,
yes,
process, how does this workflow revolve around the cassette solution?
The goal is that the personnel should avoid to be in contact with the hands to the potential contaminated tips of instruments. So the instruments should stay contained in closed containers, okay, and then transported safely to the sterilization room and ready for the cleaning process inside the thermodisinfector or washer machines for dental instruments. Then, so in that way, all the potential contaminated instruments are already cleaned, and then to be transported and packaged, and once they are packaged, to be sterilized in the autoclave. So the personnel, they do all this process without being in touch with any instruments. So, but this is not only about organization, so safety. It is organization because we are doing that, but it is also increase the efficiency of the dental office. So I would summarize the 3 benefits in organization, efficiency, and safety.
So a dentist who's on the fence, they know they need to turn an older practice around and bring in some new systems. This is an opportunity for them to look at the benefits of the cassette, and you summarized them very well.
Yes, but just to give you an example, okay, we did a survey that using the IMS solution, this system, the practice can save from 5 to 10 minutes by procedure. So just make a calculation how many patients there are in your dental office. So using the IMS system and make the calculation of the time saving, so you have your increased revenue.
There's enough disorganization in a lot of dental offices,
yeah,
and this is a place you do not want to be disorganized. I mean, you want to have, for the safety of your team and the safety of your patients, you want repeatable and safe sterilization of your instruments.
Yeah, and last, I say it is like a checklist during, like the pilot, when there's to take off it is the same. You have the standardization of all the process, so there is nothing that is done by chance. You are all the step by step, and you have just to check, done, and it was done in the proper way.
And you know that confidently.
Yeah.
Well, thank you for walking us through Hu-Friedy's cassette solution.
Thank you.